In collaboration with Business Week magazine, CBS News has been investigating advances in surgery. One involves an operation that a third of women have by the time they're 60. It can lead to weeks of painful recovery, but it turns out that kind of discomfort and recuperation time can be significantly reduced. As Dr. John LaPook reports in tonight's Eye on Your Health.
We're going to look at her anatomy first.
Dr. Lori Warren is a surgeon who has a startling diagnosis for women.
I am on a mission.
She thinks hundreds of thousands of them are getting the wrong operation every year.
I'm outraged that doctors are still, in my mind, doing these archaic surgeries on people or opening them up unnecessarily. We're just going to right now just kind of look around.
The surgery she's upset about may be archaic, but it's very common. Hysterectomy is the surgical removal of the uterus. About 600,000 are done every year in this country. Most are recommended because of pain and bleeding from fibroids.
If patients really know that they have options when it comes to hysterectomy, that we'll start seeing some of the changes that I feel need to happen.
What's happening now is that the vast majority are done the old-fashioned way, with a large surgical incision and a 6 to 8 week recovery.
I just think that we need to open less people up.
Dr. Warren is one of relatively few surgeons who perform hysterectomy with a minimally invasive laparoscopic technique. Like all laparoscopic procedures, a camera is inserted through a tiny incision to see into the abdomen. 2 other small incisions are made so that tools can be inserted.
Can dissect here like that.
It's all over in about an hour, and patients are usually home within a day and back to normal within a week or 2.
Does it still amaze you after all these years?
Oh yeah, I'm amazed by what we can do, and what's most amazing to me is how well the patient does.
Becky Rupert just had a hysterectomy, literally. Now, she wants to go home.
So about 5 hours ago you had your uterus out, and how do you feel now?
I feel great. Yeah.
And the amount of pain?
I have no pain, literally no pain.
I'm really thinking about this all the time.
What frustrates Dr. Warren is that only about 15% of hysterectomies are done this way.
You would think in today's age and the way that we've improved in so many other areas in medicine that women would begin questioning this, but we're finding that they're not.
So that's exactly where you want to be.
About 90% of all gallbladder surgeries are done laparoscopically. So why not hysterectomy?
Women are not seeking second opinions. They're going to the gynecologists that deliver their babies. They have that trust in them.
It makes my blood boil. It does. And that's what fires my passion to get the word out. So I never put a trocar in blind.
And to get the word out, she invites doctors to come to Baptist Hospital East in Louisville and learn the procedure.
What would you want for your wife or your mom or your sister or your best friend? You would want them to have the least invasive procedure possible.
This surgery is not only easier on patients, it saves the healthcare system money too. Katie?
Is that because patients have to spend less time in the hospital? I can't believe that one patient said,
Isn't that amazing?
I have no pain, right?
Right.
And they get back to work sooner as well. So if this is so great, John, why are so many doctors still doing it the old-fashioned way?
Katie, I think one big reason is inertia. I remember about 15 years ago when gallbladders first started being removed this new way. It didn't catch on right away. What ultimately drove it to become the standard of care that it is now is patients coming in saying, I hear there's a new way of doing this operation where I can be back to work in a day or 2. Ultimately, I think that's what's going to have to happen with hysterectomy.
So hopefully more women will demand this of their doctor.
Absolutely.
All right. John LaPook, John, thanks so much.